Dr. Mukesh, it's very interesting and inspiring in some way to know that Dr. Mukesh was born in a rural area of Gujarat, and then he moved to London via Mumbai, and now here in Boston. But another thing that takes us to the wide range of the inner journey which this gentleman as a professional has undertaken is his work and his research papers are talked about and followed especially in the field of cardiac surgery. And I came to know about the angiogenesis. What is it and how?
Yes, my career journey begins from birth in a very small town in Gujarat called Valsad, and I immigrated to big city Mumbai before I was even 1 year old, and subsequently had an fantastic education in Mumbai, and then went for surgical training to England, and eventually immigrated to the United States in 1994. Having worked out of the Harvard system in Boston, angiogenesis was a new science that was evolving at that time, and I was one of the investigators into it. The interesting part about angiogenesis is that just by injecting into the heart genetically engineered molecules, you can give birth or spring new blood vessels on the heart, which is what the heart needs, is that when it is running short of blood supply and eventually oxygen, these small new blood vessels can bridge that gap. And this technology is in the development stage, and now there is stem cells, which mitigates the same thing what angiogenesis is doing, which is birth of new vessels. And hopefully with just like most progression of science, it will see the light of day during our lifetime, and it will become an alternative therapy as opposed to bypass surgery or angioplasty, and also a very economical therapy for patients all over the world. So I'm very excited about having played a small role in angiogenesis, and looking forward to its clinical implementation all over the world.
So we will wait for that to happen. And also stem cell research has often been in the news, and there has been some people who support it, and there have been people who objected to it, and there were cases when government is supporting it wholeheartedly, or maybe the funding is not available, things like that. Now, the stem cell therapy for heart, what does it mean? And allow me to request you to briefly share for a common man, when we say stem cell, what we actually mean?
Well, stem cells is the kind of cells, one of the type of cells that are present during birth. Restricting our conversation to the heart, what is currently offered to patients is laser therapy for the heart, patients who are not amicable to routine bypass surgery and other procedures. But at the time of laser surgery, we also extract stem cells from the iliac crest, which is the hip bone. So bone marrow is extracted, it is filtered. There is a filtrate available ready-made, which contains very healthy stem cells. Those stem cells are injected in the peri-ischemic zone where the laser is not able to do much of the job. And so clinical trial results are showing that there is growth of viable tissue over there. And so that helps in salvage of the heart, and that is being done by stem cells. And I think this is again a very promising future, because it comes from your own bone. And there is very external need, and it's also very economical access to a solution as opposed to a company manufactured product.
So sometimes we wonder, the body has been there for God knows how many years.
Since birth.
Since birth. No, not just this body, as human body on earth. So thousands of years journey we have done, and yet we do not completely know about what is there in it. We keep on trying, and like you mentioned about these new research and other ways which probably would be implemented to take care of heart. But we go back to the human need to learn more and to find the connections. In some reference, President Barack Obama said they failed to connect the dots. So now we are trying to connect the dots, which would enable us to live fully and beautifully and to the best capacity that is there in us. You as a doctor were not sort of satisfied with the knowledge that you had, and you opted to go in for MBA also. What was the need, and how it sort of helps you in doing what you are doing?
Doctors, when they go through formal medical school education, typically are not given any management or business-related education. So the understanding of the business in which you are a significant player, and in doctor's case, it's in the healthcare space, is very little. So you are just a tool or a provider of a service. I think doctors need to have a better handle on what is also happening behind the scene for improvement of services and eventually for economic benefit to the patient and to the system as a whole. Currently, hospitals in America are run by MBAs who are not physicians. So they are Wall Street MBAs who understand the bottom line and they can understand the financial statement, but do they really take into consideration a patient? Healthcare is a very pulsatile industry. Unlike other motor cars and other industries, you need to understand the patient. You need to have a heart for the patient. And if you have a good handle also on the numbers, I think the total service provision that a doctor can provide to the industry is far better. I wanted to play in this lifetime also that additional role and try to wear that hat of a management person and to see how it is. But I didn't want to do it just on the job or acquire experience on the job that many people do. I wanted to go through a formal education. So I took a sabbatical and I enrolled in a one-year executive MBA program from a top MBA school from UT, and I graduated with honors. What it has done is it has not only given me a grand business education, but it has changed my outlook to life. I view things in a different perspective as opposed to others. My vocabulary has changed. I'm more comfortable talking about the GDP of a country and looking at a balance sheet of Coca-Cola or even from a hospital. I could never venture doing that before. I'm very comfortable doing that now. And I'm hoping that in this generation, more doctors would go for that kind of an education so that we can play a larger role than just being a physician taking care of patients. There is a bigger responsibility that we can take on.
Wonderful. So what responsibility you want to take on is decided by you, and at some point you feel that you want to add a few more skills or you want to increase the way you see up to the horizon. Maybe you want to go beyond wherever you are, and this particular spirit of breaking the boundaries, going beyond the limitations is what keeps us going and makes us happy, and it fills us with enthusiasm. And before I let you go, I would extend the belated birthday to you on your 50th birthday. And many times at 50, people look back and see, how come if I look at my life as 100 years, then this is the middle of the life, and what have I done and what is it that I should be doing differently? So in your, what was the realization?
Most people, when they reach an age of 50, I mean, it's a great number for celebrations. So we did our celebration in India with all our old friends, neighbors, and the people that I grew up with. And of course, there were my professors and teachers and all the surgeons from Bombay. But most people call 50 as, midlife crisis age. In my case, I think it was a rude awakening. It was like Sunil Gavaskar or Tendulkar as a cricketer. They all are given a second innings in the cricket field. I think after 50 is a second innings for a physician, where you don't want to do exactly the same things what you did in your first innings. You want to be more productive in your second innings and give it a very good whack.
Wonderful. So being more productive also involves being healthy, and being healthy from a layman's point of view is when you are able to smile and you are in a position to do away with tension. So stay stress-free and work out your life in such a way that you never have to see a cardiac surgeon like my good friend of 30 minutes, Dr. Mukesh Hariawala. But you do see him on television and learn from the tips that he has shared with us. Lots of good wishes to you, and thanks a lot for being with us.
Thank you for having me on the show, Ashok. It's been a pleasure.
This is Ashok Vyas thanking Dr. Mukesh and all of you for being with us.